Hello everyone, how have you been? Welcome again to my YouTube channel. If you are new, you are very much welcome. My name is Damilola Oyetola and I film about faith, medicine and lifestyle. Okay, so I forgot to wish you a happy new year. Happy new year to you. I hope that your year is going well. I hope that you are able to kickstart all those your new year resolutions that you wrote down. I hope that you've broken them down into tiny bits and able to put them into actions so that you're able to see results. All right, so without wasting too much time, my name is Damilola Oyetola. Okay, I've said that earlier. All right, so in this video I'll be talking about routine medical tests that I think you need to do, or yearly medical tests that I think you need to do. All right, before I continue in this video, I want to implore you to kindly watch to the end. Don't forget to like this video if you think that it has been beneficial to you. Also share with your friends and family, and subscribe to my channel. It's very important. And if you have any questions, or you have comments, or you have suggestions, please don't forget to put them in the comment section. Like I said earlier, I'll be talking about routine medical tests or yearly medical tests that I think you need to be doing. Now, when I say routine or yearly medical tests, it's for people that don't have any baseline or underlying medical condition. So if you have any chronic condition, you need to listen to your doctor and do the tests that they've been asking you to do part time. Okay, so why should you do a routine medical test, or why should you do yearly medical test? Now it's important because it helps to keep track of your overall physical well-being, and then it helps to see how your body is changing over time, and then because of that you're able to make informed decisions about your health. So you should see it as a kind of preventive maintenance that you give to your cars so that it doesn't suddenly break down, right? Okay, so furthermore, some of these tests can actually detect changes that are going on in certain organs in the body. For instance, a blood test can pick up abnormalities in the kidney, in your thyroid, even in the liver. All right, so without wasting too much time, I'll just be talking about the different tests that I think you need to do in no particular order of importance, and there are seven of them. All right, so the first test on my list is the full blood count, and some people call it complete blood count. Now, the components of this test include the hemoglobin, red blood cell count, white blood cell count, and platelets, and then the differentials of the white blood cell count. All right, so from the result of this test, it could say whether you are normal. It could say if you have infections, and the amazing thing is, it could tell whether you have bacterial infection, viral infection, fungal infection. Also, it can say if a person has blood cancers. Now, from the result of this test, your doctor maybe give you medications or ask you to do further workup tests so that a specific diagnosis can be gotten in addition to your symptoms, if you have any symptoms. All right, the second test on my list is the kidney function test. Now, this test basically checks the function of your kidneys by checking the electrolyte, urea and creatinine level. Now, the kidneys are very important organs of your body that you do not want to joke with. So please, if you're an alcoholic, you take a lot of herbal concoction, you take a lot of analgesics for pain, if you're hypertensive or you're diabetic, please, you should see this as your cue to actually check the function of your kidneys. Okay, all right, so the third test on my list is the fasting lipid profile. Like the name says, it's a fasting test, meaning that your healthcare provider will have told you that you need to fast overnight. So maybe you eat at 8 p.m. at night or around 9 p.m., and then you do not eat anything again till you go to the laboratory to do the test the next day. Now, there are two major cholesterols in addition to other cholesterols that this test is going to check. So we have the good one, which is HDL, and then the bad one, which is LDL. So it is bad in the sense that it can actually allow plaques to form in the arterial walls. So imagine it like a pipe that is already clogged up with dirt, and then water is not able to flow freely. So when these plaques actually clog up the arterial walls, it could actually lead to things like stroke, heart attack. It is let me not bore you. Okay, from the result of your fasting lipid profile, right, your doctor could actually give you medications, or you might need to do other sort of investigations. Okay, so I think this is the fourth one, right? So the fourth test is the fasting blood sugar, and it's also in the order of fasting lipid profile. So you fast, and then your blood sample is obtained, and then you get your results. Now, a lot of people think that you need to be diabetic before you get your fasting blood sugar done. No, anybody can actually do the fasting blood sugar, so you do not need to be diabetic. All right, so the interesting thing is that this test could say whether you are normal, whether you are pre-diabetic, or if you are full-blown diabetic. Now, from the results, your doctor is going to tell you that you may need lifestyle modification, or if you need to start treatment ASAP. The fifth test on my list is the breast ultrasound scan or the mammogram. Now, the importance of this cannot be overemphasized. And if you have family issue of breast cancer, you should actually not take this lightly. So you should see this as your cue to do your breast scan or mammogram. The one you require will be based on your age. So when you get to your sonographer, then you'll be told which of the tests that you need to do. Okay, so the sixth test will be the pap smear. Now, pap smear is done for women, and it's not a test that is done every year. It's done every 3 years, and from the age of 21 years, regardless of sexual intercourse. Now, pap smear is done to detect cervical cancer. Now, because cervical cancer may actually not produce symptoms until the person already has full-blown cancer. So how this test is done is that the speculum will be inserted, and then scrapings of the cervix will be obtained, and then it will be viewed under a microscope, so it could tell whether you are okay, whether you have dysplastic changes that may lead to cancer, or if you have full-blown cancer. But whatever your result is, your doctor is going to advise you on the right thing to do. All right, so the last but not the least, the seventh test on my list is the serology test for infectious diseases like hepatitis B and C, and then HIV. Now, if you think that you have a risky lifestyle, or your job would actually put you at risk of having this kind of infections, you should actually see this as your cue. I think I've said see this as your cue a lot of times in this video. So you should just see this as your cue to get this test done. You don't have to wait until things have gone AWY and out of hand before you begin your investigation and start treatment. Now, when you do your investigation on time, if you are fine, fine, glory be to God. But then if all is not well, then you might require further investigations and then start treatment. All right, thank you for watching this video to the end. I think that you will have learned something new from watching this video. So please, I'd like you to like this video, subscribe to my channel, share with your friends and family, and of course, I would like to see your comments in the comment section. Until next time, do stay safe and remain blessed. Bye.